Garissa and Tana River counties grapple with the aftermath of climate change-induced floods. Over 144,000 people have been displaced in Garissa County. In Tana River County, more than 300 expectant and lactating women in 52 IDP camps are cut off from the medical supplies after 11 hospitals were marooned by floods. The situation is dire in Garissa as the lack of clean and safe water, limited access to health services and food insecurity raise an alarm for the sorry state of reproductive health and malnutrition exposing expectant and lactating women and children under 5 years. The Kenya Red Cross confirms that about 58,000 women of reproductive age need urgent medical intervention. Our reporter Levis Musumba visited Garissa and Tana River counties and filed the following report that highlights the dire state in the IDP camps.
The Youth Muslim Internally Displaced Persons Camp is the new home for Fatuma Abdullahi Awade, a mother of two who is 7 months pregnant. She was displaced due to the devastating floods that hit her village 2 months ago.
Tuko na shida ya chakula sana na shida ya maji.
Life in the IDP camp is undoubtedly challenging for Fatuma.
Sasa kama mimi mama mjamzito napata shida sana hapa. Kibarua hakuna, chakula ya kula hakuna. Leo nikipata nakula, nikikosa kesho nashinda.
We are concerned about the state of especially pregnant women who cannot access services because health facilities have been marooned, they have been cut off, and so service delivery is a challenge. Household situations have been upended.
Besides Fatuma, Mariam Ishaka, a mother of 5, sits calmly at the door of her tent, holding a 3-month-old baby. Her bloodshot eyes clearly speak of fatigue and the burden on her shoulder to feed her family.
Chakula ni shida, mpaka utoke nje utafute maji, usafi, choo. Ni vitu yenye tunapitia challenges. Afya pia ni shida, mpaka tuende nje hapa kwa kambi.
More than 300 pregnant and lactating women who are in the IDP camps, and we've reached out to them with support, with wash supplies, whereby we give them water purifiers, water jerrycans, buckets, and then bar soaps. And then we've also trained them on hygiene promotion.
Fatuma and Mariam are among over 24,000 households, approximately 144,534 people affected by unprecedented floods triggered by intense rains across Garissa County.
We were not even able to take food to the sub-counties. Through WFP, now we were able to move using a helicopter to areas that were cut off completely in the county.
The floods have left a trail of destruction, with the 68 health facilities inaccessible, 15 submerged, and over 100 pregnant mothers forced into IDP camps in Garissa. This crisis is impacting the lives of thousands and threatening the very fabric of reproductive health in these communities.
These are some of the counties where maternal mortality is the highest in the country. For example, Garissa at 641 over 100,000 live births. So if there is no access to skilled birth attendants, it compromises all the measures that we are putting in place to ensure safe delivery.
2 hours drive brings us to Danisa Camp in Garseni, Tana River County, which houses 313 households of IDPs. Garseni was hard hit by floods as Tana River burst its banks, causing widespread displacement. Out of the 52 IDP camps in the county, 32 are located in Garseni.
We have around 30,000 households who have been forced to move out, and some are integrated into other people's homes, others are in the camps.
With 11 hospitals submerged, Alia Mohammed, a mother of 4, has no access to health services for her sick child, and that worries her most.
Tukilingi yetu tunaenda Isoe. Na kwenda Isoe ni fare. Kama una fare unafunga mtoto mgongoni paka Isoe. Uende na mguu urudi na mguu. Mimi mwenyewe niko na shida ya pumu. Mara kwa mara nasumbuliwa na pumu. Hiyo pumu ikinishika kama Yani hakuna hospitali yote karibu paka nipelekwe na pikipiki nende nikapate sindano.
Limited access to health facilities and primary outreach sites is impeding outreach services to already vulnerable communities, and this is projected to have a long-term impact on the health sector.
We have UNFPA whom they have donated some of the lactating items and commodities, and also we have Red Cross on board dealing with the malnutrition issues.
Since the onset of El Nino rains, Garissa and Tana River have each reported 8 and 6 casualties respectively.
Right now we are managing the issue of cholera in Tana North, here in Galole, and also in the Delta. And as Madam said, at least there is a record of 1 death and several others being managed at the CTUs.
In response to the crisis, the Garissa County government have allocated 100 million Kenyan shillings for the emergency relief. Additionally, UNFPA has donated 1,323 mama kits, 45 inter-agency reproductive health kits, and over 19,000 sanitary pads to safeguard women and girls from health emergencies in Garissa and Tana River counties.
The mama kit helps the lactating or pregnant mother to take care of their child. The Dignity Kit has a range of items that enable adolescent girls and young women to manage their menses with dignity.
While the Kenya Red Cross has initiated rapid assessment, nutritional surveys, disease surveillance, and mass distribution of treated mosquito nets.
We were also doing mass screening of malnourishment among the pregnant and lactating women, as well as the children under 5. And then we are also doing referral cases of the serious malnutrition cases.
To address these challenges, it is critical for communities, governments, and international organizations to implement adaptive strategies that focus on improving healthcare infrastructure, promoting sustainable livelihoods, and building resilience in the face of climate change.
We are now looking at a shift from early warning, early action to anticipatory action as a more reliable approach to preparedness and response. And that is something that UNFPA is committed to working with stakeholders to realize.
Levis Msumba, KTN News.
Hope beyond the tunnel as December inflation